Hi, my name is Dr. Elizabeth Tseng. I'm here with the Health Research Council for the American Psychological Association's Division 38 Health Psychology Division. Today we're talking with health researchers from the division. With me first is Jennifer Pellowski, who actually won one of our HRC awards. Jennifer, tell me a little bit about what you're doing now after you finished your PhD.
Yeah, so all of my research has been focused on medication adherence for people living with HIV.
So what does medication adherence mean?
Medication adherence, for this population, we try and have them goal is 95 to 100% of their medications within a month. And this is important for a couple different reasons for people living with HIV. The first piece that is important is for the person living with HIV. Antiretroviral adherence has been shown to reduce viral loads to undetectable levels, as well as increase immune system functioning.
So if I'm a person living with HIV and I take my medication at least 95% of the time, it can help my actual disease not, kind of be obvious.
Right, absolutely. So it increases physical health, immune system functioning, quality of life as well. All the secondary diseases associated with living with HIV, you're going to have less of those if you're adherent to your medication.
So like infections and other things
like
that.
Disease progression, you slow disease progression by being adherent to your medication. So the other way, or other reason that this is so important for people living with HIV is as a secondary prevention method. So studies have shown that people living with HIV that start their medications early, into when they know that they have HIV, and are adherent to their medications, they're less likely to transmit their HIV to a negative sexual partner. The decrease is 96%, which is absolutely incredible.
So if I have HIV and I take my medications the way I'm supposed to for the whole time, I'm much less likely to spread the disease to somebody I care about.
Absolutely, yeah, absolutely. And that's, studies have been done on sexual partners, but this is also true for injection drug users as well.
Okay, all right. So it sounds like medication adherence is really, really important in people living with HIV.
Absolutely.
How do we know if somebody is adherent to their medication? How do we know if somebody's taking it?
Yeah, so there's a couple different ways that this has been looked at. There's no gold standard, at least in our field, for medication adherence. But there are several different ways, both subjective and objective, to kind of assess how adherent someone is to their medication. So you can ask them, right? Do a 3-day recall. How many doses do you think you missed in the last 3 days? You can also use a visual analog scale, which is a number line from 0 to 100, and then just have them mark what percent of medication do you feel like you've taken in the last month.
So kind of how well do I feel like I'm doing at this?
Yeah, so this is that subjective part. There's also objective measures as well. So in our research, we use unannounced pill counts a lot. So counting, we do it over the phone. So training people how to count their medications and then using ratios for how many they were supposed to take for that time period versus how many they actually counted that they took. You can also
you're still asking people, but you're getting them to count their pills.
Right, exactly. So it's a little bit more objective. I've also used Wise pills, which they're electronic pill boxes. They're about this big, so about the size of a cell phone. And every time that the participant opens it, it sends a cellular signal to a central server that they've opened the pill box. And so there is a little bit of an assumption that when they open the pill box, they've taken their medication. So it's better for measuring kind of unintentional missed doses rather than someone purposefully not taking their medication, right? So
because they could just open the pill box.
Exactly, right, and it would send a signal. You can also use, although it's much more expensive, blood concentrations of how much medication is in the bloodstream of these antiretroviral medications. So it's kind of a continuum of balancing subjective, objective, and then as well as price. How to conduct research.
And how intrusive it is.
Yeah,
it
absolutely.
seems like drawing blood would be pretty intrusive, whereas asking people how many pills do you have left is a little bit kinder.
Yes, absolutely.
In your studies.
Yeah, so it is definitely a balancing act as far as being intrusive and accuracy and those sorts of things.
So that's how you study medication adherence. Now, I know that one of your main focuses has been health literacy.
Yes.
Can you tell me a little bit about what health literacy is and why it's so important?
So health literacy is really, it's not just reading, right? So that might be your first kind of thought when you hear literacy. But it's the ability to read, but it's also to understand and then act upon health information. And actually, the Institute of Medicine has found that almost half of all American adults have issues with health literacy, have issues kind of understanding what their doctor's telling you about prescriptions they're trying to put you on, those sorts of things.
I think almost everybody has an experience where they've looked at a prescription bottle and say, what does
that mean, right? When it says take every 4 hours, does that mean I wake up in the middle of the night in order to take it on a regimented 4 hours? Yeah. I think everyone has, some moments of that. But where it becomes problematic, especially for people living with HIV, is when you don't understand that information and then can't act upon it. You can't ask your doctor questions about it. So that's really my goal of this research award, was to look into self-advocacy as a way of kind of overcoming those health literacy barriers.
So talking to your doctor?
Yeah, so self-advocacy can include communication skills, ways to navigate the healthcare environment. It can be as simple as asking your doctor questions when you don't understand. But when you're put into a health situation, you might not know, this doctor knows everything, and I'm just supposed to kind of follow their directions. I'm not supposed to ask questions. I'm the patient. When really it's an important part in improving your own health, being that active participant, and interacting and overcoming those barriers to understanding, well, what is this medication? Because people that have issues with health literacy are less likely to be adherent to their medication. They don't know what it's for, or maybe they don't understand the dosing schedule, or do I take it with food? So they become less adherent. And that's why this kind of health literacy and adherence piece work together.
Okay. So it sounds like you're already talking a little bit about how people living with HIV can help improve their adherence.
Absolutely.
Is through advocating for themselves.
Yeah.
So what are some of the things that your research found?
Yeah, so it's actually ongoing. So we're doing these interviews with people living with HIV, just talking about how do you navigate your healthcare? How do you interact with your doctor? And what we found is a lot of people don't actually advocate for themselves. They'll doctor hop, right? So if they don't get what they need from a doctor, if a doctor doesn't show or doesn't ask them, do you have any questions about this or whatever, they tend to go to a different doctor instead of trying to foster a relationship with that doctor. Ask them questions, advocate for your own health. So that's one of the main things. And we've also seen a lot of barriers navigating healthcare. How do you get a doctor? And what's important for people living with HIV also is social services. So finding a case manager to help you get on health insurance and navigating the health insurance aspect to it as well. So that's been a big barrier to try and overcome, especially if you're given information, if you have low health literacy, where do you even begin? I think that's the biggest barrier.
Okay, so medication adherence, really important for people living with HIV and for their partners.
Yes.
But there are a lot of problems with medication adherence, especially for people who have low health literacy, and your work is trying to help ameliorate that.
Yeah, absolutely.
Where do you think your research is going?
Yeah, so the way I originally proposed this project was as intervention development. So conducting this qualitative piece in order to inform interventions for medication adherence for people living with HIV who have health literacy. So applying some of these ideas about how do you communicate with your doctor into an intervention framework that they can actually take those skills and skills building and apply it to their relationships with their doctors. So it's very focused on the person living with HIV rather than focusing on like a doctor intervention is how I've been thinking about it. How can we give people living with HIV skills in order to be able to enter any kind of healthcare environment and be able to feel confident in them and their health and being able to advocate for their own health.
All right. Thank you very much.
Thank you.